Health doesn't always shout. Sometimes it whispers. And if we don't tune in, we might miss it. Welcome to Health Unfiltered, a series by Fullerton Health. Here, real people share the moment they choose to pause, check in, and take charge of their health. These are stories of courage, of early detection, of life's change, not by symptoms, but by a single decision. Because behind every diagnosis is a voice, a family, a future, and a reminder that the best time to act is before it's too late. I'm your host, Veronica, and I invite you to listen, reflect, and be inspired. This is Health Unfiltered. Let's begin. Mental health at work doesn't exist in a vacuum. The way we cope, relate, and perform as adults is often shaped long before we step into our first job. On this episode of Health Unfiltered, we will discuss how mental health evolves across life stages and why that matters for today's workplaces and future workplace. Thank you for joining us today, Dr. Hong. Mental health is such a big word today, right? In workplace, in schools, in our social life. Can you help us define what is mental health conditions? What are the mental health conditions and how has it evolved over time?
I think if we were to talk about mental health, how we define it, that's a very big sort of area to define. Like how do we define physical health as well, right? I guess perhaps one way to look at it is what's the impact on mental health in terms of our daily life. And of course, I think this sort of varies across life stages. So perhaps, when we are looking at people who are studying, I think one key thing would be to look at the educational attainment, social relationship. So I guess good mental health would enable this, kids, teenagers, young adults to be doing well in this aspect. And as we move into the older age group and I guess the working adults, occupational functioning is very important. So again, good mental health would mean that someone who's able to, contribute to their work meaningfully. And of course, a big part of it, for someone in perhaps their 20s, 30s, it's also about perhaps, I guess if we talk about traditional kind of things, marriage, ability to form a family, good mental health, being in a good mental state will allow someone to sort of achieve that. But of course, I think in modern society, we also don't define having a family as something that is critical. I think there's also other things that people look out for, in terms of personal fulfillment. So I guess essentially being in a good sort of mental state allows one to achieve what they want in those sort of domains. I think another part that you were saying, mental disorder. So I think in terms of mental disorder, the concept, if we were to compare to physical health disorder, sometimes it can be a bit hard to define. I guess with physical health disorder, for example, if we were to talk about blood pressure problem, diabetes, there's usually a blood test, and there's a cutoff. And if you're above that cutoff, then, you are deemed to have a certain condition. However, with mental health, in this aspect, there's no sort of numerical definition. Often we talk about, I guess, what are the symptoms that are present. And the most important part, again, is what is the impact on the functioning. Generally, if people have symptoms and there's a clear impact in terms of the functioning, then we would sort of term it as a disorder in that sense.
Yeah. So we go into something deeper. WHO data reveals that there's about 1 billion people globally that has mental health conditions. And in Singapore, there are about 300 to 400 mental health linked suicide every year in Singapore. As a psychiatrist, what does all this number mean to you?
I guess every death by suicide is something that we do treat it seriously, right? And I think the general trend is also that death by suicides are increasing. Some of them, perhaps they do present with, they do have a history of mental health disorder. Some perhaps they never, came to seek help. But I think knowing these figures are really very important. And of course, I think beyond that is also trying to have an understanding of why it's happening, because then that will help us to shape how we can prevent this death by suicide as well.
Yeah. And if there's a patient that comes to you to say, Dr. Hong, I cry silently at night and I try not to make noises so that people can't hear me. Does that take pain to the next level for the patient?
I think in a sense, yes, because I guess it sort of portrays the picture that they are suffering in silence. And I guess that was something that had been, that perhaps has been happening in the field of mental health for a long while, where, mental distress shouldn't be something that is expressed openly. But hopefully, in the current day and age, with the changing sort of mental health landscape, people would be more open in sharing their distress. And I think this should be applicable to both males and females as well, because sometimes there are also certain differences in an expectation of how perhaps a male and female should express their distress. But I think we should build a climate where, different types of expression of needs are identified and attended to.
Yeah. And you specialize in women, adolescents, as well as young people, right, in terms of mental wellness. Has it changed in terms of the proportion of gender getting into depression and coming up to you to seek help more often than before?
Okay, so I guess if we were, unfortunately, you mentioned, I work with mainly women for the past few years, so I don't see a lot of the adult male patients. But if you were to talk about the younger sort of population, teenagers, actually I do see a fair few of, teenager boys coming in with emotional struggles as well. So perhaps that's a reflection of what I guess is being sort of taught at school in terms of emotional literacy. I think that is one component that the Ministry of Education has become quite focused on. And I guess as a whole, Singapore is stepping up their game in that aspect. So I guess I do see a sort of fair number of young males coming in talking about their struggles as well.
And what sort of struggles are most common amongst the younger people in Singapore?
Primary school kids, they tend to present with neurodevelopmental issues. So, for example, conditions like attention deficit hyperactivity disorder, that's coming up a fair bit as well. Autism spectrum disorder, they do present as well. And I think part of why they are presenting a bit more, I think it's also the sort of public education on this sort of condition, so allowing sort of early access to screening and treatment as well. If we were to move into the sort of secondary age group, that's where we see a little bit more of the anxiety and mood difficulties coming up. Those often would be driven by academic pressure, peer relational sort of issues. And for some, I guess, unfortunately, who come from a disadvantaged family background, I guess the baggage and trauma from their early childhood experiences also tend to come up.
Sure. And is there any difference between the younger adults and maybe the adults that are working already in the workforce in terms of the kind of anxiety they face, the depression that they have to go through?
So I guess in terms of, I guess if we were to talk about their source of stress, of course with school-going kids, academic definitely, is a huge source of pressure. Alongside that, given that current stage of life, the importance of peer identity, so that's quite common source of stressors, so bullying at school, they do come up. I guess when you move a bit into the working adult kind of population, then the work stressor would be, of course, more prominent as they are looking into forming their own family, or for individuals who have formed their family and have children, then stresses in terms of marital caregiving responsibilities, they tend to come up. And I guess these caregiving responsibilities does not solely limit to the caregiving of children. For some who have elderly parents, then there's also that being responsible for their elderly parents as well. So the nature of, I guess the source of stress, they evolve over time. In terms of how they express it, perhaps, for the younger population, they are still at the stage in terms of learning to express their feelings, learning of ways to cope with their feelings. So they may not be sort of fully skilled in that part. So sometimes it can be difficult for them to express. So they may not be able to exactly say that, they're feeling depressed or they're feeling anxious, and it may come up in other form. For example, even like physical symptoms. So often you see kids with multiple physical symptoms. You've gone to the doctor, nothing come out of it. Then I think it would be good to consider whether there's a mental health origin in it.
Yeah.
So, adults, of course, I guess in this part, in terms of being able to express their feelings, we do hope that, adults have that ability. But what we also see is that if for the young people who never really had that chance an opportunity to learn about their feelings, to regulate their feelings, sometimes they may also then have difficulties in their later adulthood to talk about all these struggles as well. So sometimes it's not too dissimilar in terms of, how they express their needs.
Or how they cope with the stress.
Correct.
You spoke about a few things, right? One, we talk about the children. If you put the same child in a different environment that's a bit more relaxed when it comes to growing up phases, right? Will this child be much better in terms of the mental state?
I guess it's possible. It's possible, right? When we look at mental health, and if we were to talk about mental health condition, what are the treatment interventions? One key thing is always to address the source of stress. So if, academic pressure is something that is really driving all these difficulties, then by alleviating that, a change of environment, in a sense, it will help, with some of the struggles.
Yeah, the reason why I ask this is because a lot of parents or young parents with young kids, right? Sometimes we forget we could be the source of stress to our children. Already there's so much pressure in school, academically I need to perform. And if parents are not educated in terms of how to better de-stress their children, it might add on, right? And therefore, certain parents may see certain behavior, or teachers may see certain behavior as performance-related, and not realizing that it's because we have inevitably caused some stress to the child. Yeah, so I think that's also something that I think driving awareness of that amongst Singaporeans would be very helpful for the children, not to add on, but to alleviate, to help them alleviate. Then we talk about the younger, or the teens, right? The younger adults. They face different kind of social pressure from our generation, or my generation for that matter. Do you see a trend in these young people that they become a little bit less resilient because they know that I have a certain condition, or they have a stigma that if I were to express to people that I have mental condition, I have challenges in expressing my emotions or managing my emotions, then I will be outcast by my colleagues or my friends. Yeah. Do you see that coming up amongst young people?
I think one, important thing to sort of address, your question is how we define resilience, right? Perhaps if we were to talk about 10, 20 years ago, resilience might be defined by the fact that you just endure everything, you don't complain about anything, everything that is given to you, you just do it, right? But I guess I'm not too sure if that is really applicable in this kind of day and age. In terms of if we were to think about resilience now, perhaps it's more about understanding, your limits. What is it that you're capable to do? What is beyond your limits? And when things are sort of beyond you, that it's okay to ask for help, and knowing that after asking for help that you can rebound. I think that is probably a more holistic view in terms of defining resilience. So in that sense, I don't think necessarily that, younger people in the current generation are less resilient. In fact, they may be better in terms of understanding how they feel and being able to sort of draw boundaries. But I guess the tricky thing may then to be how do we ensure that there are adequate support to it, and how, people around them respond to their emotional needs. Yeah.
And that is really quite true, because the younger people today are probably a bit more vocal. They know how to express themselves, and they can learn how to cope with their emotions much better than maybe 10, 20 years ago when people are growing up, right? Maybe I kind of move away from this topic to detection. Is there such thing as early detection of mental condition, or late stage detection of mental health condition?
Yes, definitely. I think prevention is always a key in terms of both physical and mental health. And I do see some of it coming into play in sort of Singapore. I mean, given my experience with my past work, where I work a lot with perinatal patients, so screening of depression in pregnant and women who have just delivered, there are active programs that are happening. So that is, I guess, one important thing when we talk about prevention of mental health. And maternal health is particularly important because of its effect on the growing child as well. We do know that, if a mom suffers from mental health issues which are not being well managed, the child subsequently may struggle with their own mental health issue, right? So I think this is one clear example of how screening, especially at the sort of maternal stage, helps to prevent subsequent mental health issues in offsprings as well.
Yeah, so there are two things that you mentioned. One is detection for maternal health, right? Is it really possible to detect that I can potentially have a condition that is not present now? For example, today I'm pretty well. My mental health is quite strong. But because of a certain stage of my life, it could be giving birth, postnatal, then it triggered something in me that kind of put me into a mental condition. It's possible?
If I understand you correctly, I do think it's possible. There is, a lot of ladies that I've seen, actually, they've been functioning very well up to the point that they get pregnant or they deliver. Sometimes at various life stages, there are various demands, and sometimes things can tip over, but that does not mean it's permanent. It may be a temporary thing, right? So with that, I think that if we time it correctly, we can pick up individuals who may be at higher risk of mental health conditions. And I guess I think to sort of accurately say if you do develop, I think that does require longitudinal sort of monitoring.
And about also learning about the history of this person, what they have gone through in their early days of their life is also quite important.
Yes, of course.
So it could be the reason why I have mental condition right now is because it could be triggered and reminded me something of what happened when I was very young.
That's very
what
true.
I was going through, right?
Yes.
So the second thing that I wanted to kind of ask you about is this. how a mother's mental condition can affect the offspring. Does it mean that if I'm going to a to-be mother, or I'm planning to, give birth to a child, should I consider not having a child because I have mental condition for the sake of the well-being of the child?
I think that's a very sort of extreme kind of thought, right?
For sure.
But I would say it's not something that, women that I've met, it's not something that they have not brought up as well, right? So, I mean, definitely there's higher risk for the offspring, but that does not guarantee definitely, right? There are, of course, other things that, one can do to sort of mitigate that risk. I think what is important, of course, knowing, having that higher risk and all this, I think that's important. But I think what is even more important is actually the environmental kind of factors. So sometimes we talk about gene versus environment, how much of it plays a part. And I think increasingly there is recognition that environmental factors are actually quite important. So I think things that would be helpful in terms or protective against, mental health difficulties, for example, I guess, what are the early caregiving experiences like? What is the quality of parenting that the child receives? The ability, what are the sort of how is the environment, like physical environment in terms of where the child is growing? Is there access to sort of, I guess, basic needs? I think basic needs, of course, we need to consider, but also is there access to, help when, a child is trying to express needs? So that emotional availability, that's also very important. So in that regards, I guess for the mother who has pre-existing mental health issue, it's important. What is even more important, I think, it's for their mental health condition to be to be stable, well controlled. I think that's important so that they can be emotionally available for the child when it's needed.
Yeah. Recently, I heard a story, Dr. Hong, that a mother found out that she has bipolar condition after giving birth, and the behavior of the mother may have caused the child in the child's growing years to become depressed, right? So under such situation, as a psychiatrist, what kind of help can you render the mother and the child to help them get out of this kind of situation or the tension, the struggle that they are going through?
I guess what you've described showcase, like, how again, like maternal health is closely linked to the offspring's mental health. I suspect what I'm hearing in this situation is that the mother bipolar was probably not very well controlled, and so in this situation, I think emphasis on a regular treatment plan, be it medication or psychological intervention, and being sort of compliant with it, I think that's quite important. I guess with the child, it's important to understand what is the nature of the difficulties, what age the child is, because if you can imagine a primary school age versus a secondary school age kid, they would have very different needs. If it's not so bad, nowadays school, I think most school, they do have at least one school counselor, right? So they usually are a good source of support if, let's say, the emotional difficulties are not too complicated. I think the other good thing about school counselor, if once they get in touch with the kid, is that they are also trained. If, let's say, something the kids struggle a bit more than what they can handle, nowadays school counselors are built with the knowledge to know where they can refer to. So typically it will be, I guess, psychiatrists who specialize in child and adolescent mental health. Yeah.
We shift gear a little bit to men. There's also studies to show that men are becoming a little bit in terms of the stats, in terms of suicide cases, right? Are men and women built differently in managing mental health condition?
it's built differently in terms of, biologically.
Yes.
And also, I think it's partly shaped by societal expectations.
Okay.
I think for a long time, we do know that the completed suicide rates in male do tend to be a bit higher, whereas female, they may try a bit more, but they may not complete suicide in that sense. I think what we understand of this sort of picture is because male, once they set their mind in terms of doing something, they generally would go through with it. Yeah, so that's why the rate of completed suicide are higher. Females, I guess, they may be sort of more open in expressing, how they feel. But with that being said, they do tend to carry their emotional difficulties over a longer period of time. So like traditionally, male, they are told to suppress their feelings, like boys, they don't cry, right? So they tend to keep it within themselves for extended period of time. And often when they, and even their symptoms, it may not be the traditional, they won't say like, oh, they're depressed or they're anxious. It may, symptoms may, they may come across as irritable, not performing at work, or having risk-taking behaviors such as alcohol or drink driving, and that may be a reflection of or an expression of their mental health difficulties.
And I've also come across friends or colleagues, past colleagues that men, right, and they shared with me what they are going through. And the amount of stress at work actually caused them not to be able to perform. But it didn't happen in the past. It is only at the later stage of their life, they realized that the amount of stress at work is something that pressed on them so hard that they can't breathe, they can't think, they can't perform their work anymore. And like you say just now, because men are told from young, you can't cry, you can't express yourself, you need to be a tough guy. And the moment they collapse, they don't know that there's help, right? And as a father, as a male figure at home, they don't want to share with their family what they're going through. And therefore, suicide becomes something that kind of becomes the only way out for them. And I've seen male suicide, I think 2 in the last 3 years, from maybe friends, the network, right? And we realize these people don't express themselves that well because in social gathering, you can't tell this person is unhappy or that person is suffering. Like Robbie Williams, right? We can't tell that he was suicidal. How do we at work or even in our social environment be a bit more, be a bit more knowledgeable or a bit more sensitive to such symptoms or, sickness that our friends, our family members are sending to us? Or whether it's male or female, it doesn't matter. How do we become more aware of such sickness so that we can be a bit more proactive in finding out how to help them?
I guess to start off with, I think that it needs to begin like discussing about mental health in general needs to become something that is quite natural, right? That is not a taboo, right? So I think that sort of environment needs to be created. I think being sort of vulnerable and open about how you're feeling definitely invites, I think it invites conversation and makes the other party more willing to talk about their own struggles as well. Sometimes rather than labeling certain things, like if someone, becomes a bit more withdrawn, rather than thinking what's wrong with that person, maybe being a little bit more curious in terms of, hey, what's happening with him? That will also invite, I think, more conversation in that aspect. So I think that's very important in the workplace as well, where psychological safety is very important, because only with psychological safety then you can talk about mental health issues. sometimes with working adults and typically those in more like high stressful, demanding corporate kind of environments, it can be quite hard to talk about their mental health difficulties because they may be worried that there may be repercussion. Hey, would I be deemed incapable? Would I be penalized? Would I be robbed of that promotion because they might think I'm weak, right? So I think mental health needs to be deemed as important and something that people can freely talk about, and important leaders in organizations can talk about as well. Because if they do talk about it, then of course, employees will be more comfortable in that regards, right?
The environment needs to be a bit more inclusive of people with different kind of conditions, not just mental health conditions.
Yes.
Yeah. But I think this whole drive awareness on how to better include people with mental health condition into our work environment, and how to embrace them, how to take care of them, how to even look out for sickness to make sure that we are there for them. It will be very helpful for people who are really struggling. This next question I have is, do you think, Dr. Hong, it's possible that we are all born depressed? Somebody asked me this question before. Is it possible that we are all born depressed and it's triggered at different time of our life that we are not aware of?
That's a very interesting question. I guess it's just like a similar question that comes to mind is if we are born good or evil. I would like to think that we are born with a blank palette, and perhaps, because of our early childhood experiences, maybe some of our palette are brighter in colors. Some of our palette, unfortunately, maybe, more dark. So I think it's more of, how we grow up and how it molds our palette. Yeah. And our tendency then to perhaps look at things in a more positive versus a more negative manner.
Dr. Hong, what would you like to see in terms of mindset shift in mental health in Singapore?
I think it's undeniable that mental health has come into a lot of people's attention. At this point, we are still seeing, I guess, individuals with mental health disorders coming into treatment as that being the focus. But I think the shift should happen in terms of, rather than focusing on treating disorders, we should actually think about what to do to promote mental well-being. And if we were to look at the population, if we will talk about the younger population, school-going kids, that would start within school or even at the home setting, where parents should become very comfortable in emotional literacy. So what that means, talking about feelings, not only about the kids' feeling. I think it's important to talk about their own feelings as well. And if things get out of hand, it's okay to seek help as well. So I think that's quite important to happen in at the home front, right? So at school, I feel that everybody should be equipped with the vocabulary of talking about feelings. So this would include, school kids, counselors, teachers. And I think importantly for, I guess, adults, they should be also equipped with skills to pick up or to detect, kids who may be struggling. And importantly, kids who may be presenting with sort of atypical symptoms, because those are the ones that typically get left out or get help a bit later. If we were to move on to the adult working population, I think a change in terms of organizational culture is important. So when we talk about, earlier we talked about how for working adult, a large source of stress would be work-related stress. So I think it's important to for organization to consider what contribute to this stress. Working hours, expectations of work, leadership, communication and trust. I think those are aspects of work culture that should be looked at to promote good mental well-being, and hence preventing or at least reducing incidences of mental health disorder.
How about in the family?
As kids, we learn how to manage stress and regulate our feeling from our parents. For parents, I think it's very important for them to talk about feelings openly, not only about the kids' feelings, but their own feelings as well. And own feelings doesn't only include positive feelings. I think it's important to talk about their own emotional struggles. With that, it's then important to explore how they overcome their struggles. And if there are times where things get too much, for parents to actually tell the kids that, I'm seeking help and it's okay, so that it normalizes for the kid when they struggle, they need help. And that's okay to get help.
And sometimes it can surprise you how your children can help you.
Yeah,
to
true.
normalize
true.
or regulate your emotions,
True,
right?
true.
That's something that I've learned with my children. Yeah, so thank you very much, Dr. Hong, for joining us today and for sharing.
Thank you.
Thank you for joining us. We hope this conversation encourages both individuals and organizations to think differently about mental health, not just as a workplace issue, but as something shaped over. Until next time, this has been Health Unfiltered.